Public hearing happened earlier today at the state's capitol on potential legislation addressing Maine's healthcare worker shortage. Bill would create the Maine Healthcare Education Training and Medical Residency Fund. It would provide $5 million a year for healthcare workforce development, specifically in rural and underserved areas. According to supporters, some main focuses for the fund: improved critical training placement, expanded residency rotations in rural areas, and opportunities for innovating new training models. According to Senator Henry Ingwerson, the sponsor of the bill, in 2024, the state had a shortage of over 2,000 nurses and a 21% vacancy of mental health clinical positions.
If we let these programs lapse, then we lose the momentum we have built in recent years and backslide in meeting our healthcare workforce needs.
While we don't want to sound like alarmists, we believe it is critical to address the current healthcare workforce shortage. The next 5 to 10 years will present some of the most significant challenges in our healthcare system, and we are deeply concerned.
The proposed bill has support from both sides of the aisle. A work session will be scheduled where it will be voted on by committee.